Hello, this is Group 6 from Population Assessment 2, Department of Public Health at the University of South Florida. In our analysis of the objectives of the Healthy People 2020 program, we are taking a look at the roles of trained public health professionals in global health. The objective that we seek to address is to increase the number of public health professionals trained by the Global Disease Detection Program worldwide. Healthy People 2020 has determined that a significant geographic gaps in disease surveillance coverage limit the ability of the United States and its international partners to rapidly detect and contain emerging health threats. The long-term goal for the GDD is to establish 3 more GDD centers in each of the 6 World Health Organization regions. The Global Disease Detection Program is an international network of laboratories and public health professionals that work to provide on-site analysis and testing for emerging diseases and outbreaks. Key directives for the GDD include increasing measures for disease preparedness and communication between health agencies and government agencies, as well as international communication, establishing measures to mitigate infections caused by animal to human transmission, and conducting localized research efforts to influence public health policies. There are currently 10 regional centers which provide short-term training for an average of 2,000 personnel each year. This is important because the Global Disease Detection Program sees new infectious diseases to continue to emerge every day, which pose a significant threat to national security. Diseases like anthrax, Ebola, drug-resistant bacteria, Zika, and various flu strains can spread around the world in a matter of days due to the exponential increase in commerce and travel. Along with the GDD, there are a multitude of partner organizations worldwide, many of whom have paired with the GDD through the Field Epidemiology Training Program. These partners include organizations in every major regional area, which draws on local populations to be a part of focused epidemiology initiatives. These organizations assist in training workers in laboratory practices used for diagnosis and prevention, responding to infectious disease outbreaks, and working with stakeholders and nations worldwide to strengthen disease responsibilities and to promote public health initiatives. The international health regulations were created in 2005 to minimize the impacts of infectious disease and hazards to public health. The IHR is supported by international focal points in which individual nations can define key health threats specific to their own country, so that the World Health Organization is aware of threats and challenges that each member nation faces, and can counterbalance resources that each nation contributes to regional health efforts. The Global Health Security Agenda is a conglomerate of countries with at-risk populations for public health threats that seek to aid in disease prevention, detection, and response as a part of international health regulations. Funding for the global health initiatives comes largely from congressionally approved financial investments, which range between $8 and $10 billion annually. The Global Disease Detection Program receives $3.1 billion per year. These funds are devoted to programs that combat HIV and AIDS, immunizations, and emergency response efforts. Funding can also be distributed to partner organizations that the Global Disease Detection Program works with to support regional health programs. The United States government is currently the largest donor for global health issues throughout the entire world. While U.S. involvement with global health grew dramatically over the last decade, funding has declined in recent years. The monetary future health program is uncertain, as technological advances can save costs, but population growth calls for a higher demand in resources. The Global Disease Detection Program has successfully organized public health professional training sites in 86 countries in Africa, the Middle East, Asia, and South America. Training topics include laboratory science, epidemiology, preparedness, and risk communication. Rather than giving a free service or handout, such efforts also expanded host nations' own abilities to respond to emerging diseases and other public health crises. The number of trained public health professionals has grown over the past decade but falls short of 2020 goals. In 2009, there were over 37,000 public health professionals trained under the global disease detection programs worldwide. Numbers have increased at a steady pace over time so that there were 74,000 in 2012 and 116,000 in 2016. If this 4-year increase of 42,000 professionals is sustained, then by 2020, the number of professionals trained will be expected to be 158,000, falling short of the 2020 goal of 300,000 trained public health professionals. Impediments to progress include deficiencies in funding, trained personnel, and operational needs for training centers. 10 nations had global disease detection centers as of 2016, yet this falls far behind the Healthy People 2020 goal of having 18 operating centers worldwide. At each center, sufficient staff numbers are needed in order to ensure that adequate training can go forward. Additionally, funding for such training is essential. For example, without steady funding for Ebola response efforts, the outcome of current and future epidemics remains quite uncertain. The resources of training programs will need to be expanded in order to meet the important target for training 300,000 public health professionals to properly respond to global health emergencies. Our program seeks to increase the Global Disease Detection Program budget of $4 billion annually in an effort to meet the goal of 300,000 trained public health workers globally. While the 2020 goal may not be met at current rates, this goal can be reasonably achieved in another 5 years with proper support. Funding should be dedicated to add media and recruiting campaigns to increase public health professionals both locally and internationally. This funding would also serve to help train, equip, and support the public health professionals in regional settings worldwide. Funding is essential for increasing global disease detection awareness. During the 2014 global Ebola virus outbreak, the United States only had 4 citizens contract the disease, but required the aid of hundreds of healthcare workers. In response to this, Congress allocated over $150 million to the CDC Ebola response team as a portion of a $5.4 billion allocation for Ebola and health security efforts worldwide. This example shows that funding to increase awareness of the Global Disease Detection Program equates to an ounce of prevention that is worth a pound of cure. Another proposal to increase the number of trained public health professionals is to have Global Disease Detection Program training integrated into public health degree programs, exposing students in college to the GDD program and allowing them to complete the training as an internship while in school. The U.S. Department of Education, in coordination with the U.S. Department of Health and Human Services, should create and implement the proposed programs nationally and internationally. For professionals not in college, local health departments should offer the global training while the state regulates and recognizes successful completion of the training program. Conclusions. As an increased number of trained public health professionals in the Global Disease Detection Program would serve to increase worldwide abilities for disease surveillance, outbreak response, and pathogen discovery. An ever-growing global population means that additional resources and materials need to be dedicated to these initiatives. Even as technological innovations assist in solving current needs, the heart of positive impact in a global health setting lies in human hands, which we can always use more of.